In this video, we'll explore the main causes of vitamin B12 deficiency, an essential nutrient for the healthy functioning of the human body. Pay close attention to every detail, as understanding these reasons is crucial to ensure health and well-being. Vitamin B12 plays a crucial role in various bodily functions, and its deficiency can lead to a series of serious complications. The first cause we'll address is inadequate diet. Vitamin B12 deficiency often occurs in people following restrictive diets, such as strict vegetarians or vegans, who exclude animal-derived foods, natural sources of this vitamin. It's crucial that these individuals pay attention and seek alternative sources or supplementation to ensure adequate B12 intake. Additionally, intestinal absorption problems can also contribute to vitamin B12 deficiency. Conditions like celiac disease, Crohn's disease, or gastrectomy can interfere with the body's ability to efficiently absorb this vitamin from food. It's essential that people with these health issues are aware of the risk of B12 deficiency and seek medical guidance to address this issue. Another significant cause is the decrease in intrinsic factor production, a substance necessary for the absorption of vitamin B12. This can occur due to conditions such as pernicious anemia or surgeries affecting the stomach or small intestine. Without sufficient intrinsic factor, the body cannot adequately absorb B12, leading to deficiency. Certain medications can also interfere with the absorption or metabolism of vitamin B12. For example, prolonged use of medications like proton pump inhibitors, often prescribed to treat gastric ulcers or acid reflux, can reduce B12 absorption by the body. It's crucial that people using these medications are aware of this side effect and discuss with their doctors about strategies to avoid B12 deficiency. Another factor to consider is advanced age. As we age, the body's ability to absorb and utilize vitamin B12 may decrease. This may be due to physiological changes in the stomach and gastrointestinal tract. Therefore, it's important for the elderly to pay attention to adequate B12 intake and, if necessary, consider supplementation. Vitamin B12 deficiency can have serious health consequences, including anemia, neurological problems, chronic fatigue, and nerve damage. Therefore, it's crucial to recognize and treat this condition properly. Vitamin B12 supplementation may be necessary in cases of confirmed deficiency or in at-risk groups, as mentioned earlier. In summary, understanding the causes of vitamin B12 deficiency is crucial to ensure optimal health. Whether through a balanced diet, regular medical monitoring, or supplementation, it's essential to address this issue proactively. Do not overlook the importance of this vital nutrient for the proper functioning of your body. Vitamin B12 deficiency can be caused by various factors, from problems in the absorption of this essential vitamin to inadequate intake through the diet. This deficiency can lead to serious health consequences, affecting the nervous system, red blood cell production, and other vital functions of the body. One of the main causes of vitamin B12 deficiency is the lack of intrinsic factor production by the stomach. Intrinsic factor is a protein produced by the parietal cells of the gastric mucosa and is essential for the proper absorption of vitamin B12 from food. Without intrinsic factor, vitamin B12 cannot be efficiently absorbed by the intestine. Pernicious anemia is an autoimmune condition in which the immune system attacks and destroys the parietal cells responsible for the production of intrinsic factor. This leads to a chronic deficiency of vitamin B12 and, consequently, to megaloblastic anemia, a severe form of anemia characterized by large and immature red blood cells. Another common cause of vitamin B12 deficiency is poor intestinal absorption. This condition can be caused by inflammatory bowel diseases, such as Crohn's disease or ulcerative colitis, which can damage the intestinal mucosa and impair nutrient absorption, including vitamin B12. Resection or surgery to partially or totally remove the stomach or small intestine can also lead to vitamin B12 deficiency. These surgical interventions can affect the production of intrinsic factor or the ability of the intestine to absorb vitamin B12. Additionally, some medications can interfere with the absorption of vitamin B12. For example, some medications for the treatment of diabetes, such as metformin, and certain proton pump inhibitors used to treat heartburn and peptic ulcer, can reduce the absorption of this essential vitamin. A strict vegetarian or vegan diet can also be a cause of vitamin B12 deficiency, since this vitamin is mainly found in animal-derived foods, such as meat, eggs, dairy products, and some fortified products. People who follow these diets need to obtain vitamin B12 through supplements or fortified foods. Another possible cause is advanced age. With aging, the ability to produce intrinsic factor and absorb vitamin B12 may decrease, increasing the risk of deficiency. Vitamin B12 deficiency can also be caused by intestinal parasites, such as hookworms or Diphyllobothrium latum, fish tapeworm, which can compete for the absorption of the vitamin or cause damage to the intestinal mucosa. Additionally, some rare genetic diseases, such as Imerslund-Grasbeck syndrome and Donitz disease, can lead to vitamin B12 deficiency due to problems in absorption or inadequate transport of this vitamin in the body. It is important to note that vitamin B12 deficiency can be asymptomatic in the early stages, but as the deficiency progresses, symptoms such as fatigue, weakness, dizziness, shortness of breath, palpitations, loss of appetite, weight loss, difficulties in concentration and memory, tingling, and numbness in the extremities, among others, may arise. To prevent and treat vitamin B12 deficiency, it is essential to identify and address the underlying cause. This may involve changes in diet, vitamin B12 supplementation, treatment of underlying diseases, or, in severe cases, the administration of vitamin B12 by injection or intravenous infusion. In summary, the causes of vitamin B12 deficiency include lack of intrinsic factor production, poor intestinal absorption, gastrointestinal surgeries, use of certain medications, strict vegetarian or vegan diets, advanced age, intestinal parasites, and rare genetic diseases. Identifying and treating the underlying cause is crucial to prevent and treat this potentially serious deficiency. Vitamin B12 deficiency is a condition that can have serious health consequences if not properly treated. The causes of this deficiency are varied, ranging from problems in the absorption of this essential vitamin to inadequate intake through the diet. One of the main causes is the lack of intrinsic factor production by the stomach, essential for the absorption of vitamin B12. Conditions such as pernicious anemia, inflammatory bowel diseases, gastrointestinal surgeries, and the use of certain medications can also contribute to the deficiency. Additionally, individuals who follow strict vegetarian or vegan diets are at higher risk of developing vitamin B12 deficiency, as this vitamin is mainly found in animal-derived foods. Aging, intestinal parasites, and rare genetic diseases can also be contributing factors. It is crucial to identify and treat the underlying cause of vitamin B12 deficiency to prevent and reverse symptoms, which include fatigue, weakness, dizziness, shortness of breath, palpitations, loss of appetite, weight loss, difficulties in concentration and memory, tingling, and numbness in the extremities. Treatment may involve dietary changes, vitamin B12 supplementation, treatment of underlying diseases, or, in severe cases, the administration of vitamin B12 by injection or intravenous infusion. Maintaining adequate levels of vitamin B12 is crucial for the proper functioning of the nervous system, red blood cell production, and other vital functions of the body. Therefore, it is important to be attentive to signs of deficiency and seek professional guidance for proper treatment. Be sure to like this video and subscribe to Gigantic Supplements channel for more informative content on health and nutrition. Stay tuned for new videos.